all, welcome back to Nursing Guru. So, who are not yet started, kindly start fastly. So, you have a very important update. A few of you already got, or a few people are not yet get that information. So, today I'm gonna give that information. So, before going to that, we will. It's okay, manage. So, okay, join fastly. You have a very important update from your board. Okay, so Karnataka Nursing State Nursing Diploma Board will be given one notification. Now only it has been released. So regarding that notification, we are going to give a clarification, and also for that information that is very important for you regarding your examination only. So for that reason, you have to join the live fastly. Okay, so who are watching exam motivate, yeah, I think you are asking exam postponed. You are asking with English. Okay. Exam, yes, I think you are asking regarding exam postponed, right? So that only we are going to discuss. Wait for a while. Once everybody was joined, by the time I will gonna announce. So we'll wait for 5 to 6 minutes. Okay, so hi all, hope you guys are had your tea. So join fastly, it is very important for your exam update. So here Nursing Guru is revealing regarding your exam update. So we are going to reveal, just wait for a while, already people getting, I know. So even though we are going to be discuss in detail about that news. Okay, so fastly join. Hi Nidami. Hi Nidami. Started study. Are you studying for examination? Join fastly, or should I continue? People wants to join, or can I continue? My voice is audible? Nidami, can you confirm that my voice is audible? Hello? Okay, anyhow, I'm gonna announce this circular. As usual, today we are going to take a live session regarding community health nursing. While are watching, welcome to Nursing Guru. And today, mainly we are going to discuss about the community health nursing. Before going to start my subject classes, now I want to announce regarding your examination. Okay, so that is one of the very important circular has been released by your board. So all of you can see here. You can see. In view of the representation received from the Karnataka State Association of the Management of Nursing and Allied Health Sciences Institution dated 18/12 2025, the reply from the KSNEB and the representations from various GN examination centers for postponement of the examination due to human resources and other constraints, which is due to Christmas and New Year holidays. Okay, so due to the Christmas and New Year holiday, there has been the scheduled GNM theory examination between 29/12/2025 to 2/1/2026 are hereby rescheduled to be held from 12/1/2026 to 17/1/2026. Okay, from 12 to 17 Jan. Okay, so from Jan 12th to 17 Jan, your examination has been postponed. Okay, from this particular date 29, because of shortage of the staffs in the institutions due to the Christmas and New Year holiday. I hope you guys you also can able to enjoy your Christmas and New Year. So after that you will get enough time to like this one will of course will give the enough time for you guys, so you can study well also. So many replies are coming, right? So many replies are coming. You people are telling no, not yet studied, not yet started. So for that reason, I think that is one of the Christmas and New Year gift for you. You can study now, no issues. Some people are having feeling at least it will be finish it off like that also. No issues, it is going to be finished in 2026 Jan. Okay, so 17th your examinations are going to be wind up. Okay, so once again heartily wishes for you and your preparation. You have to get past in the examination. So anyhow, attend our live sessions. So even more we will do the more series of the live sessions. You can better study with Nursing Guru also. So for me only it is a happy news. Okay, are you people happy? Sisti. Okay. Today we are going to discuss community health nursing. Okay, so hope you guys are clear with your examination updates, right? So here Nursing Guru again announcing that your examination has been postponed from 29. It is going to be postponed to 12th. Okay, 12th Jan. Okay, from 29th December to 12th Jan it has been postponed. Don't be confused. Your examinations are starting from 12th January 2026 up to 17th Jan 2026. Okay, so that is the thing you are going to focus now, and hope you guys are happy and don't leave the live. Okay, attend the live session. Again we are not going to be supposed to discussing again the important questions. Another series we can do, but again the same class you are not going to get, right? So for that reason attend the live session. So we will go with the community health nursing. As you all know that community health nursing is one of the very easy subject. So you can study by yourself also. Already classes has been finished. So we'll go with the subject. Okay, shall I start the class? Tell to your friends, let them also join, let them also get the benefits of the live sessions. Okay, we will start the class. Okay, so when it comes to this community health nursing, we already know that why it is one of the specialized area in the nursing. Why we have to study this one means definitely I can tell you regarding this particular subject. It is one of the specialized area in the nursing, and you have to provide care for the community people in this part. Like if you study this thoroughly, you know how to tackle between the crisis or the health interventions to provide for the people who are in the community. Okay, so what is this community then? Community is a group of people where located in the particular geographical area. Okay, so now you come to understand what is community, what is the community health nursing. Okay, so according to American Nurses Association, definition is there, that the particular definition you study and go to the examination. Okay, so that is also one of the important point of view to learn the definition easily. Okay, so that is also one of the easiest definition that also you have to go with. Okay, so I would give a introduction regarding the subject, then after I will move to the actual classes. Okay, so same timetable or we changing it? I think they will release the timetable again, okay, because it has been rescheduled, right? So definitely they will reschedule the timetable also. Okay, don't worry about that, Nidami. Okay, shall we start our community health nursing sessions? Tell to your friends, let them also join and let them also get the benefits of this class. Okay, so we'll go with that. First of all, I told you about this community, what is community, why the community health nursing is important for nurses. Okay, so you have to work in the rural sector or the urban sector. If you want to work in the various levels of healthcare sectors, like healthcare agencies like government hospitals and all, you have to learn about this. Okay, so they are focusing more on the community area. Hope you guys are understood now. Okay, so in the PHC, okay, primary health centers, okay, in CHC, community health centers, and taluk level hospitals and district level hospitals, so they are focusing more on the community people regarding the antenatal care, postnatal care, immunizations. Okay, so lot of things which will be there in the particular subject that we can in detail study in this live session. And as well as at the last of the live session, I am going to give you the important questions from this particular subject. It is one of the very vast subject, dear students. So you have to give your 100% efforts and 100% time for this particular subject. Once you study nicely, definitely you will remember for so long. Okay, so that kind of interesting subject is this. Personally, I like this subject so much. So this is one of the introduction of this particular subject. Anybody wants to join fastly. Again and again I am telling, so kindly join it and join through and chat through our live chat box and give any kind of doubt which will be there, you can mention over there. Okay, we can able to discuss on the particular things. Okay, so we'll start community health nursing first. Okay, so in the first year GNM, it is also one of the important subject you are going to be study. Okay, so in that particular various sectors will be there. Okay, so in the first year GNM, okay, community health nursing, you are going to be study in different sectors. Okay, so don't worry about that, there is nothing to confuse in that, but I am telling where how it is going to be divided. Okay, so first you are going to study regarding the community health nursing. After that, you are going to study about the environmental hygiene in the community health nursing. The next, you are going to study in the health education and communication skills. This is very important. See, certain group of peoples are there, they are not much educated and they are needing the health education. Especially, we have to focus on such groups to provide the health educations. So, for that reason, we need a communication skills. Understanding what I am telling? So that is the reason you have to focus more on these topics. Okay, so that you are going to study in the third topic, that is what health education and the communication skills. Okay, so the next one is nutrition. Okay, so join firstly at the last of your examination, don't feel that we are not yet attended, we not got the important questions, join fastly through Instagram also you will get the link, and you can join in the YouTube, especially in the YouTube only you have to join for the live. Okay, so join fastly. The next fourth, okay, so health education and the communication skill sector was over. Next we can move towards the fourth. Okay, so that fourth topic is that regarding the nutrition. Okay, so nutrition is also very important. Why? Because in the community we have antenatal mothers, we have postnatal mothers, we have non-communicable diseases like diabetes and hypertension. So for that also nutrition is plays a major role, right? So like this only we have certain things under 5-year children's. Okay, so weaning will be there. So by the time what kind of food the mother has to be provide to the baby instead of breast milk, right? So these are all the things you have to educate to the patient, the peoples who are in the community, and meanwhile the patients who are come to the healthcare sector. Okay, so if you go and attend the community posting in your colleges, by the time we have certain different sections. Okay, according to this only. Okay, according to what we have discussed now, one day health education you have to provide, you have to go to the area field visit will be there, you have to go area, you have to conduct some surveys. Okay, you have to do menu plan, you have to plan a menu plan at the last day of the posting, and you have to provide, you have to select one patient. Okay, hypertensive or diabetes, antenatal mother, postnatal mother, under 5-year children. Okay, so it is one of the very beautiful experience, I can tell you. See, kindly go through your postings, don't feel bad, we need to go and we need to roam in the areas, don't do like that and all. So do that. Okay, so if you have a chance in the second, third year also, again you have a this second part, community health nursing, by the time also there is a chance, so kindly go through that. It is really one of the very best part of nursing. Okay, so you can explore lots of things with the learning. Okay, so the nutrition part also over. In that, whatever the things which will come we can discuss. Okay, so don't bother about that. So totally from this all 4 sector we are having 23 units. Okay, so 23 units will come. So one by one we can go. Okay, shall I start? So we'll go with first unit. Okay, so the first unit is introduction to community health. Okay, so there they are going to know about community health. Introduction, first unit we are going to study about the introduction to community health. So we come to know that what is the things which we are going to study in this particular unit. Very basically we will go with the terminologies of the subject. Why? Because it is one of the fresh subject as comparatively to your last studies. You are studying +2 and all, by the time you don't know about these kind of subjects, right? So freshly you have to start to study. By this time the curriculum has been designed that you have to know. Okay, so suppose if you met a person, new person, by the time you will ask what's your name, where are you from, right? If I come to your class, what I will do, I have to do one class for introduction session. I will introduce myself and I will take an introduction of your people. Okay, the things we are going to study introduction to the community health. Okay, hope you guys are understood. Okay, so there you are going to study about the definitions. Okay, definitions of the community, definitions of the community health. Community health nursing means what? Then concept of health and disease. What is health and what is disease? What is the difference between the health and the disease? Dimensions and indicators of health, health determinants. Okay, so these are the things you are going to focus on the first unit. The next thing, history and development of the community health in India and its present concept, how it will be evolved and how it is in present scenario. Okay, so that you are going to study. Primary health care, millennium development goals and promotion and maintenance of the health. Okay, so this is the thing you are going to be studying in this particular thing. Okay, so again, now I told you in the particular unit we are going to study about the definition. Okay, so definition is very important. You have the one main, no? So that main will ask what? Meaning of the following. So that meaning of the following, what we have to do? So we have to give a correct meaning by the time. Okay, so in the first sector of the question paper, there we are expecting the meaning, right? So thoroughly from the starting itself we have to go with the meaning of the particular terminology. So now you take one pen and paper, sit, okay, and listen the class. Okay, so according to the American Nurses Association, okay, that I will give you regarding the community health nursing, what is community health nursing. Okay, that we can discuss later. Before going to that, we are going to discuss about the community. Okay, community is a group of people having a different individualities but similar geographical area. So we can tell that community is a group of people located in a same geographical area. We will call it as a community. Very simple. You can learn by your own words. Okay, if you understand, you can learn. If you wanted mugaping, you will forget. Okay, so don't forget, learn this one. Okay, so the next one is we have to know about that the functions of the community. So what are the functions of the community? So which will provide a space for housing, shelter and socialization. The next one, it offers a safety and security by protecting the community members. Yes, right, we have house in the community, we will get the shelter because of that house, we can live over there, right? No, the next one is it builds linkage with the social system outside the community for fulfilling the needs of the member. There it is going to help to us in the socialization. Okay, it will be builds a bridge between the community and the individual, so we can able to the society. Okay, we can able to be know about the socialization and we can able to fulfill our needs of the social things. Okay, the next one is offers opportunities for employment. So this is very important. So when it comes to community, we have two types of community, urban community and the rural community, right? So the rural people, so lack of job will be there we can see the social problems like unemployment, poverty. So due to that, people are going to be mobilize or they will come to the urban areas for what? Job opportunities. Okay, so understanding. So the community will offering us a job. These are the functions. Then it aids in protection, distribution and consumption of good and services. Okay, which is going to be provide a good services for the people. These are the functions you should remember. Okay, if they are asking, you have to write. Okay, so the next one we can move with the next thing, community health. Okay, so the community health nursing. Before going to that, we are going to know about the community health is defined as the a broader way of community organized efforts for maintaining, protecting and improving the health. Okay, it motivates individuals, families to change behavioral patterns to seek a medical care that would help in achieving optimum health. Okay, so community health means it is a broader way of community organized efforts for maintaining and protecting and improving the health of the people. Okay, so that is what community health. So another one, according to the WHO, they have given environmental, social. Community health is the environmental, social, economic resources to sustain emotional and physical well-being among the people in ways advance their aspirations and satisfy their needs in the unique environment. In the particular environment, we have to sustain with the proper social, economical, emotional, physical well-being. Okay, so that is what the community health given by WHO. Hope you guys are understood the definitions. Next we can move with the objectives. Objectives will be there in the first unit. So you have to strengthen the community resources, to control the counteract environment, and to prevent and control the communicable diseases and the non-communicable diseases, to provide specialized services for various kinds of health problems. Okay, and like if you have like especially the vulnerable groups which will be present in the community, which is antenatal mothers, pregnant women, like antenatal mothers, and as well as the postnatal mothers, lactating mothers, and as well as we are having under 5 year children, and we are having geriatric in the sense elderly. Okay, so all vulnerable group it is focusing. Okay, so the next one, conduct research. We can conduct the research to curb the communicable diseases, non-communicable diseases. We can conduct survey, how many people are suffering with this and what kind of interventions we can do in the nursing field. Okay, so these are all the things. So suppose we can take an example that so many anemia cases are reported. So by the time we used to conduct the research to eradicate the anemia among the adolescent girls. Okay, so that kind of things which we can conduct. The next one is to prepare health personnel. Okay, so for preparing the health personnel, you are the nurses. Okay, so you have to prepare. For your preparation you need a certain area, no? So there, those are the objectives of the community health. Okay, hope you guys are understood. Now we can move to the community health nursing. Shall I continue? Nidami, are you there? Okay, so according to American Nurses Association, this one only I am going to take deeply. Why? Because in the introduction part and all you have to add this, right? So for that reason, so American Nurses Association in the year 1980, they defined the community health nursing as a synthesis of nursing practice, and public health practice applied for promoting and preserving populations health. Okay, preserving the population health, promoting and preserving the population health. So here American Nurses Association in the year 1980 they given, so for promoting and preserving population health. So to preserve the health of the population, so we have certain measures should be taken in the community, the nursing practice and the public health practice to promote and to preserve the population health. Very easy definition, no? You can remember, right? So we can go with the next one, characteristics of community health nursing. This is also very important. Once again, I will tell about the definition according to the American Nurses Association. So the American Nurses Association has given a definition in the year 1980. Community health nursing is a specialized area, or community health nursing is defined as a synthesis of nursing practice and public health practice applied to promoting and preserving the population's health. Okay, so very easy, no? You can remember by yourself, study 1 or 2 times, listen to the class 1 or 2 times, for sure you will get pass in the examination. Okay, so the next one is characteristics of community health nursing, that you can write by yourself also. Once again I will read it out. Okay, so we don't have such more time to explain each and everything. So it is a synthesis of community health with nursing, and it considered as a whole community as a one unit. Okay, so a whole community as a one unit or one client we will consider as it is, and we can emphasize on primary level prevention. We are most focusing on the prevention of the health and preserving the health of the population here. The next one is it promotes self-care responsibilities. It involves multidisciplinary team approach. Okay, certain team which will be there in the community health nursing practices. Okay, so in the community health, the level of care, okay, primary level of care we are giving means we are comes under the primary health centers. Okay, so there is a particular health care disciplinary team which will be there. Okay, according to that we have to approach them and we have to take the treatment, right? So that teams are very important, their decisions are very important. Then it works for people, with the people and by the people. Okay, it is for the people, by the people and with the people. Okay, so for that reason it is all togetherly we will call it as it is for the population preserving health. Next one, it seeks support from and providers support to personnel from other sector working in the community for welfare and the development. Okay, we can seek the help from other sector people also to prevent the health, okay, of the community people. Okay, then it provide continuous and episodic care, okay, which is going to provide a continuous and episodic care. Okay, we can provide continuous and episodic care. So this is all about the first unit. Then next one you have health. Okay, so in the first unit only health is a concept, so you already know the definitions of the health very well because already your first year going to be wind up health. So the next one, the determinants of concepts of health. Okay, so concepts are telling that biomedical concept will be there, ecological concept, psychological, psychosocial concept, holistic concept. Okay, so the four concept will come: biomedical concept, ecological concept, psychosocial concept and a holistic concept will be come. Okay, so they can ask for 4 marks short notes. Okay, the next one is dimensions of the health. So in that we have physical health, mental health, social health, spiritual health, emotional health and environmental health. I tell you, if you remember the definition of the health, you can write the dimensions of the health also. Okay, so it is very easy. When it comes to the physical health, we are going to be focus more on the hygiene, good complexion, bright eyes. Okay, then good appetite, sound sleep, clean breath. Okay, so these are all the things which we can able to be see in the dimensions. Okay, the next we can move with the indicators of the health. Okay, so hope you guys are clear with that one. Next we can move with the indicators of health. So mortality indicators, first one is mortality indicators and the second one is morbidity indicators. Third one is we have disability rates. Fourth one, nutritional status indicators. Fifth one, we have health care delivery indicators. Okay, the sixth one is social and mental health indicators, environmental indicators and socio-economic indicators. Okay, so once again I will repeat: mortality indicators, morbidity indicators, then we have disability rates. Okay, what are the disability rates which will be present in the community, and nutritional indicators, nutritional status indicators, healthcare delivery indicators. Okay, which is all, if you know the terminology better you can go with that. Okay, the social and mental health indicators, environmental indicators, we have environmental indicators, socio-economic indicators. Okay, the ninth one is health policy indicators and the 10th one is health for all indicators. Okay, health policy indicators, health for all indicators, which is including everything. Given below are the 4 indicators introduced by the WHO for monitoring the progress towards the goal of health for all. Okay, so health policy indicators, social and economic indicators related to the health, and indicators for provision of health care, for particularly focusing on the health care only. Then health status indicators. These are the major important healthcare indicators. For sure there may be a chance to ask this question. Okay, so 10 healthcare indicators you have to thoroughly know about this one. Okay, Yes, exam postponed. Okay. So for that reason you people are not attending live. Huh? Attend the live, okay. So again we are not supposed to repeat the same classes. If you attended, definitely it will be benefits for you only, for your exam only, for your exam preparation only, right? No. So next one, health determinants. Okay, so health indicators, 10 health indicators we have seen. Now we can move to the health determinants. Income and social status. Okay, income and social status. So the next one is we have employment. Okay, health determinants, education, social environment, physical environment, healthy child development, personal health practice and coping skills. Okay, so how to challenge, how to focus on personal health and as well as the coping skills. If any kind of things which will be affecting also, we have to cope up with that. Okay, the next one is health services. Health services, social support networks. Okay, better health result support provided by families, friends and communities. Okay, so for that reason social support networks also important. Biology and genetic environment and gender cultures. Okay, these are the major determinants of the health. Okay, so this is all about the health determinants and the indicators of the health. Everything was discussed. Okay, so from this, the for sure they may ask any kind of questions which is comes under the short notes. Very very important. Don't forget to study this one. Okay, we can move with the disease. Okay, so disease is a condition which prevents an organism or body from functioning normally. It is termed as a disease. We can't able to perform a normal body functions. Okay, so that it is affecting on our normal body functions, we will call it as a disease, right? So in this disease, concept of disease are very important. So it is going to be categorized into three. The first one is intrinsic, coming within the body; extrinsic, developing from outside of the body; and the unknown origin. Disease cause is by unknown. Okay, there is no proper cause, we should not know. Okay, so we can't able to know the cause. Okay, so that is what regarding the concept of disease. Okay, so that disease is going to be categorized into intrinsic. So okay, I will take another page. So we are discussing now disease. Okay, so disease. So we have categorized into intrinsic, extrinsic, and the third one is unknown origin. So either within the body, and this one is outside of the body, coming from outside of the body, and which is the cause is not known by you. Okay, so that is what the next we can move with the types of disease, communicable diseases and non-communicable diseases. Based on the infectious diseases, we are going to classified communicable or infectious diseases on the basis of causative agent, bacterial diseases, viral diseases, protozoal diseases, helminthial diseases, or fungal diseases, rickettsial diseases. Okay, so all these classification you remember. Okay, so this is very easy, no? So either you can remember at least communicable diseases, non-communicable diseases. Communicable diseases means what? Which is spread from one person to another person. Then non-communicable disease means what? Which is not going to be spread. Okay, due to the lifestyle changes, we may get this one. Okay, so this kind of diseases. Okay, or non-communicable diseases, which is also called as non-infectious diseases. Okay, two members were there in the live, so people are understanding what I am telling. Kindly attend. Okay, so next we can move with the theories of disease and all will be there. That is not much important, but you have to study that too also. Okay, so the next one, we are in the first unit. We have that what we have, other concept, primary health care and all will be there. So elements of the primary health care, so you can remember education, locally and endemic disease prevention and control, and we have expanded program immunization. The next one, maternal and child health care we need to be provided in the primary health care centers. The next one, nutritional food supplement has to be provided, and next one, treatment of communicable and non-communicable diseases and promotion of the mental health and the safe water and sanitization. Okay, so these are the elements. Okay, if you write element and one by one you write it down. Okay, elements of the primary health care. Okay, the next one, principles also there, equitable distribution, community participation will be there, and intersectoral. So intersectoral coordination, appropriate technology will be there. Okay, all these things are very important. And the next one is levels of primary health care. The first one is health promotion, disease and injury prevention. The third one is diagnosis and treatment. Fourth one is rehabilitation care. Rehabilitation means what? To bring back the proper health status. Okay, so rehabilitation means bring back. Okay, so the next, fifth one is supportive care. Okay, which is like we have to provide a support, taking support from the families and the community also. Okay, so this is the thing you have to study thoroughly. Okay, so the functions also will be there. First, contact accessibility and comprehensiveness, care coordination, continuity care and people centeredness. Okay, the next one, very important sector of your examination, role of community health nurse or the role of primary health care center. Okay, so they may ask about this also. Patient career. The next one is organizer, quality controller, problem solver, educator, or practice of staff and other things, and we have agent of connectivity. Okay, so these are the roles you are going to play in the primary health care. Okay, so these are the the role of nurse in the primary health care. Okay, acts as educator, acts as a patient carer. Okay, acts as an organizer, acts as a quality controller and acts as a problem solver. Okay, manager, director, whatever you want to write you can write. Health educator, okay, coordinator, okay, organizer, planner, you can write any role. You can write, nurse will fits for that roles. Okay, so because we are doing each and every work, we are providing a holistic type of care, means we have to play all the roles, like advocate also will be there. Okay, all these things we are following. No, the next one is 8 millennium development goals. There may be, this is also one of the important topic because they have mentioned in the syllabus. Okay, so when it comes to this one, to eradicate extreme poverty and hunger. Okay, so the 8 millennium development goals, the first one is to eradicate extreme poverty and hunger. The next one, to achieve universal primary education. We have to provide a primary education for all. Okay, so the initial everything education should be for all. Okay, so regarding the health, the next one is to promote gender equality and empower women. This is very important. So you have, in order to curb the female feticide and mortality rates of the female fetus, so before the birth, so that is the thing we have to promote. Certain things you should not do, such kind of things we have to go and we have to educate the people. Okay, so by using mass communication and all. So that is also one of the goal, comes under the millennium development. The next one is to reduce the child mortality. Mortality means what? Death rate. Okay, so in order to reduce the child mortality, we have to reduce, that is one of the goal from the millennium development. The next one is improve the maternal health. Okay, so to provide a proper and improvisation of the maternal mother's health. Okay, so the next one, to combat HIV or AIDS, malaria, like communicable diseases, to reduce the incidence rate of the communicable diseases. The next one, ensure the environmental sustainability. Okay, and as well as regarding the environmental sanitation. The next one, to develop a global partnership for development. Okay, so this is the thing which we are going to be studying under the 8 goals of millennium development. Okay, so all these things are patient centered. Okay, so you can easily remember, this is very important. Okay, so then promotion and maintenance of the health. So there we are going to study about the health education. Okay, how you have to provide the health education, what kind of communication are important. Okay, and the role of nurse, that also disease prevention and health protection are the 2 key concepts you have to promote during providing the health education. And in that also we are going to focusing on the role of nurse in health promotion. The nurse should assess the health needs of the patient. Okay, she has to assess the health needs of the patient. Then she should determine the risk factors of the disease. What are the risk factors affecting the keep on getting the disease condition? She has to assess that one too. The next one is she should determine the risk factor, she should assess it and inform the patients about the health associated risk. Whatever the risk factors which will be there associated with the people's health, that you have to tell to the people. The next one, she should recognize and learning preference of the patients. She should participate in the community health education. She has to organize certain community health education programs. Okay, so we are best example, like we are going to provide education regarding the tuberculosis prevention and as well as communicable diseases like HIV and AIDS. When it comes to the maternal health, we are going to provide the health education regarding the breastfeeding and the techniques we used to tell to the mothers. Okay, so like after that we have to provide a health education regarding the antenatal care, postnatal care and under 5 year children. So all these things the nurse has to take care. Okay, so the next one, this first unit was over. So from this so much of questions we have discussed, so that is also very important, and you will get in 1 mark question you will get take a pen and paper again and again. I'm telling who are watching, no, those people only take a pen and paper and write. There may be a chance to ask, they can ask community health, determinants of health and disease for 1 mark, and for short notes, determinants of health, indicators of health, role of nurse in primary health centers, healthcare, that they can ask, and full forms of CHO, WHO they can ask, and we can expect the concept of health, functions of the primary health care. Okay, that and all we have discussed. No, so those are the important sectors in this particular unit. Okay, next we can move to the second unit. The second unit is it's all about community health nursing. Okay, so there the concept of the community health nursing, philosophy of the community health nursing, and the goals of the community health nursing already we know, and objectives of the community health nursing, principles like community needs, understanding family as a unit, respect values and customs. Okay, integrating education and counseling we have to provide in the community health nursing, collaborative work we have to do, like attaining objectives which is made easier by cooperative working relationship with the co-worker and members of the health team. Okay, so you have to work in a collaborative way, you have to maintain a proper understanding and relationship which is IPR. Okay, interpersonal relationship we have to maintain with the colleagues also. Okay, so the next one is ongoing education, continuous learning. Okay, you have to learning is a continuous process, right? Till our last breath we have to learn. Okay, same like that, whatever the advancement will be there, in order to work efficiently in the upcoming days we have to improve our knowledge. Okay, so from next last day to today we have to be improved, right? So day by day we have to improve our knowledge, we have to improve our communication skills, we have to improve our work modalities, so that will make sure important in providing proper healthcare services for the vulnerable group in the community. The next one, services supervision, we have to look into the service supervision, and recording and reporting, documentation will comes. Okay, so that is also one of the important principles in the community health nursing. Okay, so little bit fastly I will move because each and everything we need to cover. Then importance of community health nursing is very important topic, and community health nurse. Okay, so regarding this one you have to know, the very first you have to know about the qualities of a community health nurse, educational qualification of the community health nurse. Okay, so what she has to take, either she has to do diploma in nursing, okay, recognized by the state nursing council institution, and she should pass the course in general nursing. See, in olden days and all, if the person pass in Hn Gnm, auxiliary nursing midwifery, so there they will take, okay. After that, if you can take a diploma in the general nursing midwifery, that is also accessible, and if you take a degree, okay, nowadays the community health officer, that post has been there, no, so they are appointed BSc nursing professionals, okay, so that is also they can work in the community health center, okay, so community health sectors. So that is very important to know qualification of the community health nurse. Next we can move with the qualities. First one is educational qualification is the one of the quality. The second one is communication skills. The third one is observation skill, okay, the nurse should be acts as an observer, that is also one of the role, keep it in your mind. The next one is ability to lead and take decisions, ability to lead and take decisions, okay, so that is also one of the important, and ability, other qualities like she should understand the human behavior, she have to manage other things, okay, she should have managerial abilities, she should have been like physically and mentally fit, okay, so both the things are very important. So that is the things you have to study under the quality of the community health nurse, okay. Next one, functions, okay, planner or programmer, good observer, I told already, nursing care provider, community organizer, coordinator of services, trainer or health educator and health monitor, role model, change agent, recorder, reporter, statistician, okay, statistician, she has to get some data, okay, regarding the mortality, morbidity rate, we have to take a statistics, okay. So did you remember the word vital statistics, okay, so we have to collect, okay, birth rate, death rate, everything we have to collect, okay. So and we are going to know about the how many like gender basis of calculation also we have to do in the community, how many pregnant women will be there, okay, under 5 children, okay, and regarding disease rate, and mortality rate, morbidity rate, everything we are going to get the data in the vital statistics, okay. So she has to act as a statistician, okay, so that is also one of the functions of the community health nurse. The next one is roles and responsibilities. So community health nurse need assessment, okay, this and all you know by yourself only, so more things we can go with the nursing process, okay, the nursing process, the importance of nursing process in the community health nursing is that holistic approach, okay. So the importance of nursing, the first one we can see holistic approach. So holistic approach, it involves the assessment, diagnosis, planning, intervention, and what it will be there last, evaluation, okay. So we have to plan, we have to execute that, when we have to evaluate that. This approach is considered as social, environmental and economic aspects impacting the community, okay. So this is the holistic approach we need to do. Prevention focus, she has to prevent the communicable diseases and promote the health among the people. The next one is identification of the health needs, identification of the health needs of the population, if identifies any high risk populations, unfulfilled health requirements and facilities, resources allocation and targeted intervention she has to done, and it also address underlying the cause of health descriptions, okay. So the next one, collaboration and empowerment, she has to focus on the women empowerment, okay, and all those things will be there. Then culturally compact care, sustainability of the intervention, okay, all those things you have to study. Steps in nursing process, okay, so especially in community health nursing, what are the steps will be there in the nursing, we know that, okay. So what is the first step? Assessment, okay, assessment, diagnosis, planning, implementation, evaluation will be there, no. So those are the 5 steps which we can able to study in the nursing process. Same that we have certain steps here also. So the first one we are using the same steps here also, but we are going to use some other names, okay. So under first one we have community identification, we have to identify the particular community, particular geographical area, okay. Knowing the population composition, okay, we have to know the how much of population composition will be there in the particular geographical area. Suppose it is one of the geographical area, what is the composition of the particular population here, okay. So that you have to focus more. The next one is finding the health and allied resources. You have to find the health and allied resources, hospital is there or not, what kind of health resources which will be necessary for this particular community, you have to find out that. So that is the third type, okay. Third type. The next one is applying nursing process in it. Fourth step, you are going to applying the nursing process only, okay, understand. So what is there? So in the nursing process I told you, no, assessment, diagnosis, planning, implementation, evaluation, the same thing. Community assessment, community diagnosis, community planning, community implementation, community evaluation. Conducting community nursing care services, you have to do the evaluation in the implementation sector, okay. After the implementation you have to do the evaluation including the community. Hope you guys are understood this one, no steps. The next one we can move with the community identification. Community identification, that when it comes to that one you knows clearly, okay. So here those are the things are very important things which we are already studied, okay. So unit 3 health assessment, okay. You are going to study about the characteristics of a healthy individual, health assessment of an infant, preschool, okay, school going children, adolescent, okay, all the things which will be comes under the like in the community, what is the vulnerable group, no, adult antenatal women, postnatal women, adult and elderly, okay. So all these things you are going to be studying. The health assessment, you have to going to check their health, okay. So in the health assessment what we will do, taking history, physical examination, inspection, palpation, auscultation, percussion, those are the steps of the assessment, right. So that is the thing we are going to do there also, okay, by focusing on all the group of people I have mentioned, okay, according to their age, okay. So that is what you are going to be do, okay. So the third unit also over. I will tell the important questions at the last, okay. So next thing is that you have to focus on the fourth unit, the principles of epidemiology and epidemiological methods, okay. So that is also one of the very important unit. So you should know thoroughly about regarding the epidemiology. So the study of distribution and determinants of health or states or events specified population, for the specified population, and the application of this study to control the health problems is termed as a epidemiology, okay. So epidemiology, what we will tell, so you are going to be study the determinants of the health, and you are going to see the states of the health and the events specified population, okay. In the specified population, the particular population, you are going to study about these factors, and what you are going to do, you are going to application of the study to control the health problems, to control that health problems, that process we will call it as a, to control this one, you are going to be apply, okay, you have to application of something else, that which is to reduce the intensity of the problem, which we will call it as the process we will call it as a epidemiology, okay, understood. Nothing but the study of disease and health outcomes in a population is known as epidemiology, okay. So epidemiology means what? Logy means study of disease condition and health outcomes in a particular geographical area or in a particular peoples. So that is what? Epidemiology, okay. So that is clear, no? So the aims will be there, methods will be there, observational studies, descriptive studies, analytical studies and experimental studies, okay, all these things which will be there, okay. So the basic to certain formula also will be there, so to calculate the mortality and morbidity rate, so those formulas are very important, and the epidemiological triad, okay. So the next important sector in this particular unit is epidemiological triad. Okay, so the epidemiological triad is useful for you tool for researching the spread of disease and possible defense against it. Okay, the three components of the epidemiological triangle are like agent, host, environment. Okay, so agent, host, environment. So these are the three components of the epidemiological triad. So next we can move towards the uses of epidemiological triad, the study of the history of the disease and community diagnosis to diagnose the community and look for risk of individuals as they affected groups or populations. Okay, so those are the things which is important here. And spectrum of disease, disease cycle also one of the important levels of prevention of disease. Okay, primordial prevention, primary prevention, okay, and secondary prevention. We have a tertiary prevention. Okay, so these 4 prevention levels you have to be remembered. That is also one of the important. And the disease transmission also one of the very important. Okay, so like what you have to do is you have to thoroughly study about the particular units, okay, according to your syllabus wise. So far we have finished epidemiology was finished. The next one we are going to see in the particular unit only immunization, okay, immunization schedule, and we are going to see the control of infectious agents, okay, infection control, that you have to going to study, and disinfection, okay, disinfection and the sterilization also you are going to study in this particular unit. Okay, 4th unit over. Later I will tell the important questions. Okay, so the next one is we have to go with the family healthcare settings. Okay, so the family healthcare settings, 5th one. Okay, so there we are going to study about the family healthcare services. Okay, all the things which we are going to study in this particular unit, like family as a unit of health, concept, goals and objectives, family healthcare services, whatever the family healthcare services which we can able to provide, no, so this family planning and all other services also which we can include in this particular unit only. Okay, so those are the things you are going to study. The next one is family healthcare settings. Okay, first one, there we are going to study about the home visit. Okay, why we need to do home visit, what is the purpose and principles of that, and planning and the evaluation and the bag technique. Okay, so that is also you are going to study here. Okay, so the bag will be there, community health bag. Okay, so the bag technique, certain steps will be there. Okay, how to open, how to keep, where to keep, whatever the modalities you have to follow. Okay, so that and all the things you have to study. Okay, so for sure they may ask for the short notes. Okay, short notes they can ask. The next one, clinic. Okay, so the clinic, referral system, records and reports, and minor elements. Okay, so minor elements also you are going to study in this particular unit. So community health nursing, still we have discussed around like in 9 units was discussed here. Okay, next we can move with the second part, that is what, environmental hygiene. In that environmental hygiene, listen students, you have to, hi Adarsh, hi Adarsh. So we can continue with the second part of environmental hygiene. Okay, so you people have any doubt in this community health nursing, you may ask me. Okay, so later on course I will give the important question also along with this, so don't bother about that, I will give definitely. So the next one is environmental hygiene. We are going to study about the water, air, waste, housing, okay, and ventilation, lighting, noise, arthropods. Okay, so this is the thing you are going to study in the first and second unit of the environmental hygiene. In the third unit, community organization promote environmental health, levels and types of agencies you are going to study, and that is how you are going to study about the things. Okay, when it comes to the waste dumping method and all the waste management methods are there, no, that is very important. So all those things you have to study thoroughly, and air composition of the air, airborne diseases and air pollution and its effects. Okay, control of the air pollution and use of safety measures. Okay, so these are the things you are going to study in each and everything, okay, in the particular sector, environmental hygiene. Okay, the second sector was over. The third sector is that health education and communication skills. So when it comes to the health education and the communication skills, we have that communication skills are very important. Okay, definition of that and the process, purpose, principles, types, like this only it will carry. The next one, health education, how the concept, definition, aims, objectives of health education and the principles of health education, purpose of health educating the people, the process of change, modification of the health behavior, methods. Okay, so all those things you are going to be study under that one. The next one is counseling. Okay, so this is also one of the very high yielding area to get the questions from this unit. Also definition, purpose, principles. Okay, in this way only all the each and every unit you have to go, okay, in this particular sector. The next one is methods of media and health education. Okay, by using the mass media and all we can able to provide a health education. Okay, the next one is health education agency and sources, international agencies, national agencies, state, district, local and internet sources. Okay, so all these things you have to cover over here. So this is how health education and communication skills also over. Okay, so the next thing you have to focus on that, one second, nutrition. Okay, so the next thing which is GNM practical some, I can't understand that, tell in English. I can understand few words in Malayalam. Okay, I am not full-fledged Malayalam speaker. I can understand bit. Practicals some material. Once you GNM practicals some. No, practicals we will tell. Okay, so according to the reschedule of this timetable only they will going to be tell about that also. Okay, so that is not it. We are not get any kind of information regarding that. Okay, so understood. You are telling about this practical exams also postponed, no? So that we can tell after rescheduling of the examination. Only we got the notification the examination has been rescheduled. We shouldn't get any kind of notification regarding the practical examination. Okay, so in order to, once they will give the timetable based on the dates, that time we can see. So attend for your exam first. Okay, so next we can see, next we will see that so we'll go with the nutrition also, food habits and custom factors affecting the nutrition and all will be there. Classification of the food is there, normal dietary requirement, energy, balanced diet. Okay, so balanced diet and diet planning will be there. Food preparation, prevention and storage, how you have to prepare, prevent and preserve, prepare the food, that and all you have to study. Then therapeutic diet, okay, depends on the disease condition, you have to provide a therapeutic diet for the patients, that you have to study. And the next one is community nutrition, preparation of the diet, okay, and diet that will be comes under the practical. Okay, so all those things which you have to focus more. Okay, so these are the complete package of the community health nursing. Most of the things which is important I have explained those things. Okay, so and whatever I have go through the syllabus, that is important only, and I will give now questions. Okay, so that questions will makes you to get a good marks. Okay, take down the questions. Okay, if you are not okay, if you are not getting, if you are not watching also, after that you can go and watch our live session. By the time you can come to understand. Okay, so the first question in nursing group we are revealing that regarding community health nursing, the long essay form of question. What is community health nursing? Explain the qualities and functions of the community health nurse. I have discussed this one. Remember, I have discussed in the initial of the class. Okay, and the next one is what is disease cycle? Okay, that also I told. So in detail I didn't took that topic, but it is there. So that is very important. Explain the levels of prevention of the disease, primordial level, primary level, then secondary level, tertiary level. Okay. So that and all you have to study thoroughly. Okay, so that is important. The next one, again we will go with the long answer. Define immunity and types of immunity. Explain detailedly about the national immunization schedule. Okay, so I told you about that also. National immunization schedule is one of the very important. Okay, study thoroughly. Then define communication and its types. Okay, again it will be comes under the health education and communication skills. Okay, there it will come. And explain the barriers of the communication. This is very important. Remember, keep on work on those questions I will give now. That questions are very important. Then next, what is infection? Okay, infection is the presence of microbial activity, okay, or the microorganism. The next one is write the role of community health nurse in control of infection. Okay, what is the role which nurse can play in the controlling of the infection. The next, define primary health care. Okay, define primary health care. Discuss the role of nurse in primary health care. Discuss the role of nurse in the primary health care. Next, long essay, define vitamin. This will comes under the nutrition. Okay, and explain the sources and functions of the vitamin A. Okay, the next one, define epidemiology. Epidemiology, we are going to study that one, epidemiology, and explain the aims and uses of the epidemiology. Okay, so those are the important questions. Next we can go with the long essay type of questions. What is disease cycle? Again it has been repeated. Okay, explain the levels of prevention of care. Okay, that one. And again one more question I will give. What is the community health nursing, and explain the qualities and functions of the community health nursing. Okay, so that is also very important. And again we have here what is audiovisual aids. Explain the purpose of the audiovisual aids. While providing the health education we are using the media, so that is there it will come. And define immunity and explain in detail about the national immunization schedule. National immunization schedule, study that one. Okay, so the next one we can go with the define family. Define family, explain the role of nurse in family welfare services. Whatever this family welfare services which will becomes there certain roles which will be played by the nurse. That is also very important. Okay, so the next one is define health. Explain briefly the determinants of the health. Okay, so from first unit pakka for sure you will get the longest form of question. Okay, so all those things I have already discussed. And again repeated, what is vitamin, list the types of vitamin, explain the sources or functions of the vitamin A. Vitamin A is a important 5-star question. That is the next one, define communication. Define communication, explain the barriers of the communication, repeat it. Okay, so that is the repeated question. Next again we can move with the define family, explain the role of family. So same question it will come. And define health, explain briefly regarding the determinants of the health. Okay, the next, so like immunity, immunization schedule. Okay, whatever the things which may like audiovisual aids and all we have discussed from the health education and mass media communication, there it will come. So all those things are very important. You can see here. Okay, define communication. Again the repetition of the question will be happen. Most of the questions we have given. The next one, give the meaning. There you can see epidemiology, family folder, mortality and carrier. Okay, so mortality and carrier, these are the things are very important. Again I told you home visit, morbidity rate, incubation period, infection control, there it will come. Okay, the next one is community health. Okay, from the first unit we can expect long essay and short notes also we can expect, and the 1 mark question. Okay, so the next one is again endemic, cold chain, community health nursing, family folder, community health nursing, repeated. Okay, so the next one we can go with the epidemiology, family folder, again repeated, incubation period and ventilation is also one of the important there. Where it will come, environmental hygiene, air. Okay, there it will come. The next one is again family folder, Okay, so these are the things which are very important. Okay, so I think I given that one of the blueprint like kind of session in this live. So if you are not attending also, no issues, go and watch the video in the YouTube channel, definitely you will pass in the examination. Okay, so if you go through the syllabus is the basic key. Okay, so hope you guys are getting the information which is related to your examination and important questions. If you have any doubt, you can ask me, or else the time already almost over, so we will wind up the session today. We will see in the next class. Until and unless you have much more time for the study and you can have again extra time, happy Christmas, happy New Year to one and all, and we will wind up the session. Don't waste the time. This is one of the best opportunity to study right now. Go with the flow, and thank you for attending the live.